According to my own experience, and also I think my sort of the observation, the recent development of Tibetan medical system, it seems quite clear now. In certain illness, for certain illness, especially what we call chronic illnesses, the Tibetan medicine usually is work quite well. Now, quite often, some patient who had even very expensive sort of treatment, but then still the problem there. Then, after taking Tibetan medicine on longer period, then sometimes good result happen. Of course, we can't say it's 100%, but there are often such cases that happen. Then, according to my own experience also, as a preventive measure, the Tibetan medicine really works very effective.
The Tibetan medical system was orally transmitted till 600 AD, when the process of codification began. This codification resulted in the great book Gyuzi, written by Elder Yuthog Gonpo, who is considered peerless among healers. Yuthog exemplified the ideal of the Tibetan healer, the accomplished man who brought the wisdom of religion to the compassion inherent in the science of healing, combining the two to become the complete healer. The Gyuzi soon became indispensable to all practitioners of Tibetan medicine. It spread quickly across Tibet, carried on horseback and by foot, till every far-flung corner of this great Himalayan plateau had received the wisdom and knowledge contained in it. This knowledge of healing, Sowa Rigpa, is flourishing even today. Amchi Lobsang has been carrying this knowledge for almost 90 years. Even today, he makes his way across the difficult terrain to relieve the suffering of the sick. His knowledge and practice of Tibetan medicine is still in demand, and he is summoned to all corners of Ladakh to effect his cures.
First of all, we have to understand what is the real cause of the suffering or the disease. And it has actually a distant and a recent cause. The main thing is ignorance. And ignorance brings three mental poisons, that is desire, anger, and obscuration. From the desire we develop an energy called lung, and from the anger we develop an energy called tipa, and from the obscuration we develop an energy called begin. And these three energies, in their balanced state, in the normal state, they help us to maintain our body.
The perfect state of balance, where all elements rest in equilibrium, is called harmony. And the basis of health within the human microcosm is harmony. The essence of health is the subtle dance of this microcosm, resonating in harmony with the macrocosm. When they are out of step, disharmony occurs. Disease is the result. The elements are in discordance with the essential spiritual reality that keeps them in perfect balance. The Tibetan art of healing is based on balance. Within the human body, this fine balance is achieved by the equilibrium of the three principal energies that determine the state of health. Usually called the three humors, Tipa represents the energy of heat, Bekan the energy of water or fluid, and Lung the energy of air or wind.
So these three energies, they help us when they are in their own location or the site and with their own average sort of amount.
Reading of the pulse is a unique diagnostic technique. The pulse can tell the physician many things. Tibetan doctors say that feeling the pulse of a patient is like listening to a voice shouting instructions from across a vast windy meadow.
Or you can say the pulse or the beat of pulse or pulsation is a messenger, a very good messenger between the disease and the doctor.
Learning the intricacies of pulse reading and negotiating its various permutations and combinations can take many years of sustained training. The pulse has many characteristics, and the able physician can determine the abnormalities in each organ or its components, linking it to physical or psychological causes. The modalities of the pulse are different in males and females. Then there are humoral pulses and the constitutional pulse. Urine analysis was one of the original contributions the Tibetans made to traditional medical systems. The physician beats, stirs and shakes the urine and then leaves it to settle. He looks at the vapor, bubbles, smell, sedimentation, color and scum and arrives at the state of humoral imbalance in the patient's body. In some cases, it may be necessary to feel the urine sample on the tongue. The theory of human physiology is illustrated in the Gyuzi using the simile of the fig tree. This tree of disease and health has 3 roots, 9 trunks, 47 branches, 224 leaves, 2 flowers, and 3 fruits. Therapies, modalities, and classification of diseases are illustrated, making easy visual references for practitioners. Angmo La has walked here from her home in the valley, a distance of 21 kilometers. She comes here for a cupping treatment, the only thing that relieves the unbearable pain she suffers in her shoulder and collarbone. Dr. Paljor studied the science of healing at Mensi Khang in Lhasa for many years. On his return to Ladakh, he has integrated modern science with this ancient system of healing. Here, he uses vacuum cups instead of the traditional copper ones. Interrogation plays an important part in the diagnostic procedures in Tibetan medicine. The physician asks the patient specific and detailed questions related to the symptoms. The physician then categorizes the disease in terms of its humor while simultaneously checking the attributes of the patient. Dr. Choidrak, the personal physician of the Dalai Lama, is treating his patient with the traditional cupping technique. Heat is applied to the mouth of the copper cup and a vacuum created. Rheumatic disorders are usually treated effectively in this simple, non-invasive manner. The use of drastic surgery has long been discontinued in Tibetan medicine. But these instruments show that a wide range of surgical techniques was practiced in the early days. Accessory practices also include the use of medicated incense inhalation through various instruments to alleviate suffering from wind-related diseases. Pain and its relief were always the primary concern of all Tibetan physicians. The Gyuzi codifies pain and its alleviation into an elaborate system of points and their relative counterpoints. The golden hammer is an archaic system of cauterization, more than 1,000 years old. It can bring immediate relief to pain associated with wind and cold disorders. Here, Dr. Choidrak treats a patient in the classical way. The tip of the golden hammer is gently heated and applied to various predetermined points. It is, however, emphasized in the Gyuzi that these types of treatment should only be used when all other forms of medication, including behavioral changes, have proved ineffective. The accessory therapy trunk enumerates wind, phlegm and bile-related diseases and specifies the treatments. Dr. Thamdin is using the ancient art of the golden needle. This technique is believed to predate Chinese acupuncture and is effective in acute cases of migraine, sinusitis and other heat-related disorders. When the tip of the golden needle lightly pierces the scalp, the moxa herb is heated. The needle is removed when the herb burns out or when the required heat is transferred to the point of application. Today, techniques like cauterization, moxibustion, golden needle therapy, venesection and cupping are widely practiced and provide great relief to patients. The Gyuzi also describes various ancillary or accessory therapies. In ancient times, these ancillary therapies had been uniquely adapted and developed by the doctors and lamas who practiced the traditional medical system. Dr. Pema Dorji is treating this woman in Siliguri in West Bengal. The patient has come from remote Arunachal Pradesh, almost 1,000 miles away. She has a chronic problem of schizophrenia and related physical symptoms. Dr. Dorji is using a special moxibustion technique. A special wooden moxa stick is heated by friction and applied to points known as the Tibetan 1st, 6th and 7th vertebrae. The heat is also applied exactly between the two breasts. A 20-year problem is being managed, controlled, and is on the verge of a cure. The Tibetans believe that the Sakyamuni Buddha himself taught medicine. In a mystical transformation, he took on the form of the medicine Buddha, Vaidurya or Menla, and gave the medical teaching known to us as the Gyuzi. Menla is the supreme model for all healers. And merely chanting his name in the mantric way aids the physician in realizing within himself all the compassionate qualities that are required to serve the ailing.
So the practice of compassion or sense of caring, and especially when they sort of meeting with patients, the genuine sort of sense of caring and sense of concern about the patient is extremely important. Actually, there is usually there is saying that no matter how the physician's qualification, if the physician not very compassionate here, then the medicine may not effect as expected. The other hand, if the physician really have warm feeling in heart, then even the knowledge may not be so perfect, but usually it goes well. So that's our belief, and also this is a saying. Then, of course, according to our own experience, when we have some sort of consultation with physician, if the physician really shows concern and I think I usually call human spirit, then according to my own experience, then I usually feel, now should be okay. I can totally rely on his or her advice or the treatment. But the physician side, the way of expression is such cool and not much sort of human feeling, only just as a professional way. Then sometimes I myself also sometimes feel little cool or a little uncomfortable. So that's, I think, human nature. I think every field, both sides, showing or having the genuine human warmth, then immediately interact or the connections immediately become warm and sound and something very positive. If that's not there, even between teacher and the student, in I think every field, without a human feeling, then it almost automatically becomes very cold and very dry. So naturally, in the field of the practice of Tibetan medical system, the physician's sort of warm heart is extremely important.
For the Tibetan physician, devotion to Menla opens up the intuitive, sympathetic and compassionate resonances within himself. This enhances his function as a healer. Everything a Tibetan physician does, he does as a homage to the medicine Buddha. His mantra is chanted while gathering herbs, making medicines and administering the medicine. Amchi Smanla gathers his own herbs and makes his own medicines. The high altitudes of the Tibetan plateau imbue the herbs with curative characteristics that are unique. The presence of such herbs on the roof of the world has been known from pre-Buddhist times in Tibet. Medicinal plants contain the specific qualities and nature of the 5 great elements from which they are formed. Earth is the base, moisture comes from water, heat for maturation from fire, air provides energy for growth, and space allows room for growth. At the Kardungla Pass, 20,000 feet above sea level, Amchi Smanla is on his herb-gathering rounds. Medicinal substances abound in this seemingly barren land if one knows where to look for them. They are present in little niches and on the surface of the rocks. The Gyuzi states that every substance on earth has a medicinal value because it shares the nature of the great elements. There is no substance on earth that cannot be used for healing. Everything is permeated with curative qualities. Tibetan healers use around 2,300 natural substances to compound the various medicines they administer. Each medicine has an element or a combination of elements that has a specific healing quality within the humor to which it is related. A remedy for a particular illness is usually formulated using a combination of herbs. The specific combination could use as many as 60 herbs. This takes care of all aspects of the illness and the human body, making the cure effective and complete. The balance and counterbalance and the fine-tuning of the 3 humors is achieved by the combination of medical substances of varying strengths and specific proportions.
When we make the medicine to treat a disease caused by heat, the main ingredient will be a cold herb, combined of course with other herbs which will strengthen the immunity of related organs.
Today, at the Tibetan Medical Institute at Dharamshala, modern manufacturing facilities are available to process herbs and minerals in large quantities without losing their qualitative effectiveness. For the large Tibetan population in exile, it has become a reliable source of high-quality traditional medicines. In the Tibetan system, there are formulations that can sometimes contain over 90 ingredients, combining metals and minerals with select herbs.
In the Gyuzi, there are many formulations which contain over 70 to 80 herbs and also metals.
Here, Rinchen Rilbu or precious pills are being made. This is a combination that acts as a detoxicant, strengthens the immune system and protects against degenerative diseases. Tibetan medicine includes a vast number of medications in various formulations that are made in liquid, semi-solid and solid forms. Very specific medications for specific illnesses. Earth, water, air, fire and space are the 5 great elements, the basic building blocks of all phenomena. The Tibetans view these great elements as cosmic energies. The Tibetan medical practitioner considers himself a representative of the medicine Buddha himself and tries hard to practice compassion towards all at all times.
Then, of course, there's certain sort of fever, the temperature as they reach very high, then some kind of emergency sort of method, then Tibetan medicine sometimes hopeless. So the allopathic medicine is much, helpful. But long run, and also the Tibetan medicines, I think one of the good aspect is they usually we take Tibetan medicine with the consideration of the patient's sort of whole body situation. So the medicine, taking the medical sort of care is more holistic way. So through that way, less side effect. Actually, I think the Tibetan medical system is, developed on the basis of Indian system, Chinese system, then I think Unani or something from the Middle East side developed, and then local Tibetan ancient medical system, all according to the medical sort of history, the Tibetan medical history. I think 8th century there was some kind of the international seminar on medicine. So participant Chinese, Indian, some the Persian, and the local Tibetan physician. So therefore, it is something they synthesized the system, and still the more sort of research, more synthesis according to with the allopathic medicine, would be useful. So that's my sort of view.